Introduction to Pharmacy as a Profession. So the word pharmacy is derived from the Greek word pharmakon, which means a drug. The word pharmacy has two meanings. So the general sense, which is the place or where drugs or medicines are sold. The other meaning is the professional sense. So it is a profession that the members of which deal with drug. So pharmacy is an art of science. This art of science deals with preparing and dispensing of medicine. It is a health profession which links the health science with chemical science. It ensures safe and effective use of pharmaceutical drugs. So a pharmacist is the one who is educated and licensed to prepare and dispense drugs and to provide drugs and related information to the public. Pharmacist is an expert on drugs. A drug is any substance that acts on living body to alter the physiological processes and are used for prevention, diagnosis, and treatment of diseases. Medicine is any drug which has a definite form and dose and are therapeutically used for treatment of diseases of living subjects. So pharmacy is a profession. Pharmacy is not only an occupation. It is a well-recognized profession worldwide. So what is the difference between occupation and a profession? So occupation is the job by which someone earns a living, while profession is an occupation characterized by extensive study, specialized training, and specialized knowledge. So the profession of pharmacy exists to safeguard the health of public. So pharmacist is one who is licensed to prepare and dispense medications, counsel patients, monitor outcomes pursuant to a prescription from a licensed health professional. So the role of modern pharmacists evolved from compounder and dispenser to providing medication information and preventing medication-related problems. So we see the evolution of pharmacist's role. So the pharmacy profession has evolved through 4 stages. The traditional era, scientific era, clinical era, pharmaceutical care era. So traditional era is formulation and dispensing of drugs from natural sources. This was in traditional era that pharmacists used to be formulating and dispensing drugs from natural sources. For example, pharmacognosy. We have pharmacognosy. This is the study of medicinal properties of natural products of animal, plant, and mineral origin. Clinical pharmacy is techniques for preparing medications. Techniques for preparing medication. So in traditional era, pharmacists is dispensing drugs from natural sources. In this case, we have the pharmacognosy, that is the study of medicinal properties of natural products of animal, plant, and mineral origins, and the clinical pharmacy, which are the techniques for preparing medicines. Scientific era, it started after World War II. And in this era, we have the emergence of pharmaceutical industry. So in this pharmaceutical industry, in this era, we have drugs made in factories, not with a car shop, not in a pharmacy. So in this era, pharmacy education emphasized sciences like pharmacology, which is the study of drugs and their mechanism of action, including side effects. And pharmaceutics, which is the release characteristics of drug dose forms. So in the clinical era, new educational emphasis on clinical patient-oriented pharmacy. We have new educational emphasis on clinical, that is patient-oriented pharmacy. It is a patient, it is characterized by being patient-oriented. So in this era, we have the studying pharmacokinetics, that is the activity of the drug within the body over a period of time, which includes absorption, distribution, metabolism, and elimination. And pathophysiology, which is the study of disease and illness affecting the normal function of the body. So we have the last era was the pharmaceutical care era. A pharmaceutical care is defined as a philosophy that expanded the pharmacist's role to include appropriate medication use to achieve positive outcomes, with prescribed drug therapy includes monitoring response to therapy, education patients, and dispensing prescriptions.